Public, if we could do about a 10-second count.
You can see.
Good afternoon, everyone. I'm Nirav Shah from the Maine CDC. Governor Mills, I'd like to turn things over to you.
Thank you very much, Dr. Shah. Hello, everybody. I join you today as our state has now vaccinated more than 60% of people 70 years of age and older with a first dose of COVID-19 vaccine. This achievement is the result of hard work by the Department of Health and Human Services and the Maine CDC and Northern Light Health and Maine Health and our many other hospital system partners and healthcare providers across the state. We owe them a continued debt of gratitude for their work to stand up and run clinics, for getting shots in arms, and most importantly, saving lives. That important work, the work of saving lives, of preventing serious illness and suffering, work which has been my fundamental goal throughout this pandemic, must continue. Today, I'm here to let you know how we intend to do that, what our next steps are. So after consulting with the Maine Department of Health and Human Services and Maine CDC, I've concluded that it would be best for Maine to adopt an age-based approach to expanding vaccine eligibility. What does this mean? Simply put, from now on, your eligibility for COVID-19 vaccine will be determined by your age. Beginning next Wednesday, March 3rd, we will be expanding eligibility to all Maine people who are 60 years of age or older. 60. This update expands eligibility to nearly 200,000 more people in Maine. Now, this does not mean you'll be able to get a shot on Wednesday or Thursday, but you will be eligible and you will be getting in line to get vaccinated. From there, we will continue to expand eligibility by age, opening up vaccinations to those who are 50 years or older in April, and then 40 years or older in May, 30 years of age and older in June, with anyone younger than that becoming eligible in July. As you know, while the supply of vaccine is increasing, the demand for it still exceeds the supply. If the supply increases in the coming weeks and months, and we're able to make efficient progress through these next phases, it's possible we can accelerate these timeframes. So why are we making these changes? As I mentioned, my fundamental goal throughout this pandemic has been to save lives and protect Maine's most vulnerable people. That's why, after vaccinating our healthcare and emergency responders, we dedicated our limited supply of vaccinations to those 70 years of age and older. Medical evidence backed by data here in Maine tells us that those folks were and are at greatest risk of suffering serious illness and dying if they contract COVID-19. Obviously, that also puts a higher burden on the hospitals and healthcare systems as well, and the ICUs. But over the past few weeks, we've been considering how to protect the lives of Maine people and how to ensure that shots get into arms as quickly as possible. Dr. Shah and the Maine CDC have been reviewing the medical literature and the latest scientific studies on COVID to ensure that our response is grounded in and guided by science. What Dr. Shah reports to me is recent scientific data indicates that age is among the strongest indicators of whether an individual is likely to get seriously ill and even die from COVID-19. Even more so than any other risk factors, including underlying medical conditions. In Maine, our experience appears to match this. 98% of all deaths from COVID-19 have been among those aged 50 and older. And as an individual gets older, their risk of serious illness and death increases significantly as well. For the most part, for the most people in the shortest time, Dr. Shah, I guess I would like to turn this over to you right now to explain the evidence that you've researched and what you've uncovered as a part of your research.
Thank you very much, Governor Mills, and good afternoon, everyone. Governor and everyone, it's a pleasure to be able to join you. I'm going to do something I don't always do, which is share a couple of slides with everybody today. What I'd like to do is talk about some of the research that our team here at Maine CDC, as well as others, have been doing to better understand the risk factors for severe COVID-19 illness. As Governor Mills has noted, Maine has focused on vaccinating those at the highest risk for death or severe disease since day one. More recent scientific data suggests that age is a stronger indicator of death or severe disease than most underlying medical conditions. An age-based approach to COVID-19 vaccination also comes with operational benefits that allow us to continue vaccinating with velocity. The bottom line is that this science-based approach means that, as Governor Mills noted, over 201,000 higher risk Maine people, 60 and over, will be eligible for COVID vaccines next week. What I'd like to do now is walk a little bit through some of the scientific data that underlie this conclusion. And I want to start by asking a question. And that question is this: if you were a doctor and you had a patient with COVID-19 sitting in front of you, and you wanted to understand that patient's risk of death or severe disease because of their COVID-19 illness, what is the most important piece of data that you would need? We asked ourselves that exact question when we started analyzing this issue a while back. And we started with a straightforward analysis, which is, how much does age impact the risk of hospitalization or death? And what you see here nationwide is that age plays a major role. As you go up in the age brackets, your risk of hospitalization as well as death go correspondingly higher. We have seen that same trend hold true in Maine. What you see here on this slide is the data from Maine. This is what has happened in Maine. In our state, 98% of deaths from COVID-19 have been among people aged 50 and older. The death rate among people with COVID-19 who are over 50 as compared to those under 50 is 8 times higher for people in their 50s, 23 times higher than people in their 60s, for people in their 60s, and 214 times higher for those who are 70 and older. As compelling as that evidence is, we didn't stop our analysis there. We also wanted to make sure that we were understanding the impact of underlying medical conditions as a risk factor, as an indicator for death or severe disease in individuals, patients with COVID. And we asked ourselves that same question: what factor helps us gauge someone's overall risk of death? Is it still age, as the earlier slides suggested, or could there be something else going on too? What I'm going to do in the next few minutes is click through a couple of studies that we assembled that compare the risk of death from COVID relative to other medical conditions. The one on the screen is just one of them. Now, while the numbers get dizzying, the bottom line is that age is a stronger indicator of whether someone will die from COVID than the medical conditions that you see listed on this slide. We looked at additional studies to make sure that we were covering the waterfront. And as the more studies we found, we started to see the same relationship emerge. The age, which is what's in that green box, turns out to be a stronger indicator of death as compared to other factors, such as some of the medical conditions that you see on the lower part of this slide. In some cases, the strength of the age as a predictor, as an indicator of death or severe illness, was quite striking. As we looked at more and more studies, we found that the data kept pointing back to age as the strong indicator of death or severity of illness. Each study we looked at slightly different variables, though the conclusion that age being that strong indicator held up throughout. Now, these are undoubtedly serious medical conditions, and we know that each of these medical conditions causes untold suffering. But the question before us is not whether they are serious conditions. They undoubtedly are. The question before us is whether, by looking at age, we can limit the number of people who die or suffer from COVID by making age the basis upon which we make eligibility for vaccination. And every study that we looked at found that age was telling us what we needed to know in order to determine whom to vaccinate to keep people alive. So going back to the question that I started with, the piece of data that doctor should ask about to understand their patient's risk of dying with COVID is a straightforward question. How old is the patient? Because that turns out to be a strong indicator of death. And our review of the data concluded that given that Maine has the highest median age of any state, this approach is what is right for Maine based on the scientific data. The result of this science-based approach is that many more Maine people will become eligible for COVID-19 vaccines next week. For both operational and epidemiological reasons, this age-based approach is what will be best for Maine in terms of saving the most number of lives in the shortest amount of time. The bottom line here is that age determines eligibility because age determines risk based on every one of the scientific articles that we reviewed as part of our process. Governor, I will turn things back over to you. And I'm sorry, Governor, you're on mute. And while you're unmuting, I will also note that we will make the slides that I just clicked through available on our website with the references and the citations to the data for everyone to take a look at. We will get those on our website very soon. Apologies, Governor, back over to you.
Thank you, Dr. Shah. That's a lot to digest, and I hope people take it seriously and come to the same understanding that we have, that age is a strong predictor of getting seriously sick or dying from COVID-19. So based on the evidence, I believe it is appropriate to continue the age-based approach that we've started in January in order to protect and save the lives of older Maine people and people most at risk. There's another reason I think this approach is important. Moving this way provides a greater measure of certainty and predictability for people. It allows Maine people to know approximately when they'll be able to be vaccinated, when they'll be eligible for vaccination at least, and it allows for more efficient and more widespread vaccinations to be accomplished more quickly. It hastens shots in arms and will help us win this race between vaccination and the emerging variants. The approach is clear, it is straightforward, it's easy to understand, and importantly, it's easy to implement and easy to verify. It replaces the prospect of complicated eligibility rules like those based on your type of work or on specific medical conditions, the verification of which I'm very concerned will become difficult to implement and could inadvertently slow down the process of getting shots in arms. You're either 60 years of age or older, or you're not. So I believe this approach will not only provide certainty, but provide efficiency that we hope will result in a faster vaccination process for Maine people, something that is particularly important as we race against the new variants of the virus. Now, I would like to offer Commissioner Lambrew the opportunity to discuss our approach to teachers and school staff in particular. Commissioner Lambrew.
Thank you, Governor. As part of the update to the vaccination strategy, I will be working with Commissioner Macon and the Maine Department of Education to set up vaccination opportunities dedicated to pre-K to 12 school staff who are eligible for vaccination within these age categorizations. The Governor hopes that by providing dedicated opportunities for vaccination for age-eligible teachers on top of their option to go to existing sites, Maine can further protect school staff moving forward. In the meantime, we have purchased 250,000 BinaxNOW rapid antigen tests that are prioritized for schools to expand regular testing and support in-person learning. The education workforce and school staff can expect to receive information from the Department of Education and the Department of Health and Human Services on when and where these special clinics will be operated in the coming weeks. We look forward to this partnership as a way to continue the speed of vaccination of Maine people. I'll turn it back over to you, Governor.
Thank you, Commissioner Lambrew. I really hope that providing dedicated opportunities for vaccination for teachers and school staff within their age categories, Maine can further protect school staff and provide more consistency for schools in terms of staffing moving forward. I also realize that some of these changes may not be the most welcome news, particularly if you're a younger person with an underlying serious health condition. I understand that disappointment, and I pledge to you that we will get you vaccinated just as we will get everyone in Maine vaccinated. The fact that we cannot possibly vaccinate everybody with potential exposure or potential risk all at once is one reason we keep telling people to please wear a mask when in a public place, keep your distance from others, and follow the public health protocols for your business or activity. We're undertaking the largest mass vaccination effort in our history, in our state's history, in our nation's history. And there are no good or easy answers to every question. I know that every decision I make will impact people in our state in different ways, some positively, others maybe not. I carry with me the weight of making fundamentally, sometimes life or death decisions. That's why throughout the pandemic, I based my decisions in science and in fact, and I've always tried to do what I believe are the things that are in the most best interest of Maine people. We're trying to do the most good for the most people in the shortest time with what we have each day. Given that Maine does have the oldest population, the highest median age population in the country, this approach, which is different from the approach of some other states, this approach will benefit the most people in Maine the soonest. I'm trying to save lives here, trying to get shots in arms as quickly as possible. After consulting the science and weighing the many considerations, I do believe on balance, this approach is the right one for our state. These times are fraught with anxiety. I want the people of Maine to know that your governor hears you, that I care about you, that I want you to know that I'm grateful for all of your understanding and patience during this historic effort. Please keep the faith. Stay safe. Together we will get through this. This simple age-based eligibility will get us through this more quickly than any other approach that I can think of. Commissioner Lambrew, Dr. Shah, and I would be happy to take questions at this time. Thank you.
Thank you, Governor. I'm going to turn it over to Zach Blanchard for the first question.
All right, thank you, Dr. Shah, Governor Mills, and Commissioner Lambrew. I know you laid it all out here, given the science and the risk posed, but we are already been receiving messages from those who are disabled, those who have underlying health conditions, who may fall under that 60 plus category that are of course anxious. And without the slides over you, Dr. Shah, what is your message to them right now?
I think I addressed that as well just a minute ago, and that is that we do hear you. There's a great deal of fear out there, justifiable fear of catching the virus. But I think that the data that Dr. Shah has researched and collected indicate that the decision we're making is the one that will benefit the most people and save the most lives. And the charts that he presented a few minutes ago do indicate that a lot of people who have certain disabilities may not be as at high a risk as people of the age groups we're talking about. I think that's the fundamental question here.
Thank you, Governor Mills. And then another issue that I know we've already touched on, looking to vaccinate more than 39,000 Mainers next week. We continue to see this uptick in the number of doses coming into the state. But we are hearing from some folks who are frustrated with the disparity between the vaccine sites in northern Maine, where there's still plenty of appointments available, versus southern Maine, where there's few. With this uptick in doses, are there plans to sort of redistribute the wealth here among those facilities rather than just saying drive to Bangor if you can?
Well, in part, the answer to the question depends on what the FDA does today with respect to the Johnson & Johnson vaccine, which, as you know, and as Dr. Shah has explained, is a different kind of vaccine. It will involve less rigorous preservation mechanisms. It'll be perhaps easier to get out to the various communities faster. And it's a one-dose vaccine. So in part, the answer to your question depends on what happens today with J&J. But I know that Dr. Shah and Commissioner Lambrew are looking at vaccine distribution every day, and equity is a primary concern of ours, whether it's income equity, racial equity, geographical equity, rural versus urban, all those things are foremost in our thinking every day.
Sure.
Yeah, but
I'll just add that, when you look at our map that is on the COVID dashboard, Cumberland County is doing pretty well. We're excited about that. They've done a great job of really trying to use some of these big sites to vaccinate people. Your county is a little bit behind, and we think that's primarily because there's not as much capacity. But the good news is help is on the way. We expect to be opening up at least one site in York County next week. We are trying to give Scarborough Downs as much vaccine as they've requested for next week, so they really can go through all the people, or not all the people, but some of the people on their list, and we will continue to try to ensure that we balance out the need. We continue to be worried about Western Maine, actually. We do know we have some gaps in Oxford County and Somerset County, but every week we look at the map, see where there are gaps, and look for how do we deploy not just vaccines, but vaccinators and other staff to those sites to try to make sure that everyone in Maine who is eligible has an opportunity to be vaccinated.
thank you.
Thanks, Zach. Over to Kevin Miller.
Great, thank you very much. Governor, question for you. Just looking at the kind of the monthly breakdown here. I mean, obviously, I think everybody in Maine hopes that we have a better tourism season this summer. Can you talk about how that factored into your decision about going to an age-based system? Because, we're looking at people in their 30s and 20s not getting vaccinated until June or July. And obviously there are probably a lot of people who work in the tourism industries that are in that age group. So can you kind of talk about how you tried to balance those two things?
Sure. I don't have specific data about how many people who work in some aspect of the hospitality industry are 50 years and older, 40 years and older, 60 years and older. That's a statistical nightmare, essentially. But when you show up for vaccination and you're 25 years old, you have somebody stop and say, well, where do you work and what do you do? And how do we know you're really in the hospitality industry in the months of June and July or not? That kind of process, that kind of eligibility determination, first of all, would slow things down remarkably so that we wouldn't get to people by June and July. We wouldn't get to a whole segment of the population before June and July. And again, our goal is to vaccinate as many people as possible to make sure the visitors and residents alike know that we are one of the safest states in the nation. That is why people came here last summer and last fall. People continue to come here. People are buying real estate here, moving here, raising families here. We want that to continue for all kinds of good reasons. And in making sure that the hospitality industry remains viable is a big part of that. We do that by setting up special training sessions, for instance, at the community colleges for hospitality workers, restaurant workers, and hotel motel workers, hotel overnight workers, to be trained in COVID precautions. So people know when they get to that hotel, that restaurant, that the person waiting on them, the person staffing them, has been trained in those precautions and will help keep that visitor, that client, that customer safe. So vaccination alone isn't what addresses the hospitality industry. It's a lot of other things.
Yeah, and those protocols proved successful last summer. I think at the end of the summer, we Hospitality Maine wrote about how great the hospitality industry did do at following protocols and keeping their workers and their clients safe. But another important element is about why we implemented the policies we did last summer. It was primarily to prevent what we've just been talking about, the oldest and most vulnerable Mainers from getting severely ill and dying from COVID-19. We wanted to prevent our hospitals from filling up and staff being out and us having to create alternative care sites due to major uncontrolled outbreaks of COVID-19 that are filling up hospitals and taking out staff. The good news about our strategy is, first of all, we began with our healthcare infrastructure. We will have, hopefully this spring and summer, our healthcare critical infrastructure safe from COVID-19. And second, should we be able to get through the 60-year-olds and the 50-year-olds by Memorial Day time, we will hopefully have gotten to those higher risk age groups before people come visiting. That does allow for some safety. So coupling what Governor Mills talked about, safe protocols with vaccination for those at most risk of serious illness or death, we are cautiously optimistic that we really can see a different type of summer in Maine than we did last year.
Great. And going back to the J&J vaccine, I know it has not been approved yet, but I guess, can you talk at all about where that might, are you thinking about using that in the teacher vaccination clinics, or, you know, how might this fit into the bigger vaccination plan here in the state?
Kevin, oh, I'm sorry, Governor, I apologize.
Well, we don't have a plan specific for the J&J yet, but we've been talking about how that might facilitate drive-through vaccination sites, for instance. And then Jeanne and Nirav can explain why. It may not require an observation period after the J&J shot. And because it's a one shot instead of a two shot vaccine, it requires only one trip instead of two. So logistically getting that out there, and it's able to be preserved longer, I believe, than the Pfizer and Moderna vaccines. So it doesn't have to be rushed out the door, should be used as quickly as possible, but it has a longer shelf life. Isn't that correct, Dr. Shah?
That is all correct, Governor. And Kevin, you know, the way that we are thinking about our concept of operations for the J&J vaccine is not so much in whom the vaccine might be given or offered, but with what vaccinators and what setups will the vaccine be ideal. And there are a few that immediately pop to the fore. One is any kind of field operation, any type of operation where we are handing the vaccine to, say, public health nurses and asking them to go on site to places where a lot of vulnerable folks live. That's one place. So anything that's out in the field. Another place is in the drive-through applications. And we're working with the US CDC to understand better whether, because this is a different type of vaccine, a vaccine that uses a more normal or a more traditional method, whether the observation period is needed. And if not, whether that opens up, as Governor Mills noted, opportunities for things like drive-throughs. So the J&J vaccine, it's less about who may receive it, and it's more about in whose hands do we put it so that they can go out and use it.
Thank you, everybody.
Yep, thanks, Governor. Let me turn it over to Amy Brown next.
Thank you, Dr. Shah, Governor Mills, Commissioner Lambrew. Will healthcare workers, newly hired healthcare workers, move to the front of the line regardless of their age, or are they going to be included in the age bracket?
They will continue to be vaccinated as they have been all along, because you can have a lot of turnover in a hospital that would basically make it vulnerable should we not vaccinate new staff that are patient facing in healthcare facilities.
Okay, and when can people start registering, and what is the anticipated rollout date for the state's call center registration system?
I can start with, go ahead, Commissioner.
Two separate questions. I'll let you answer the second one. The first one is, we do ask people ages 60 to 69 to be a little patient. We're announcing this news right now. Governor Mills just may roll this out, and we do need to give our sites time to adjust their own websites, their own call centers to get ready for this change. So we have said that Wednesday is the beginning. Some sites may take longer than Wednesday to be able to be ready to vaccinate the 60 to 69-year-olds. So we do ask for patience during this transition. Dr. Shah, do you want to answer the second question?
Sure, Amy, we are working to bring on the call center as well as a scheduling platform. We're going to be doing so in stages over the next few weeks. For example, starting with a pre-registration system and then working more toward the web-based platform. Just an important note there, the platforms that we are bringing on, some of them will allow folks to call and get access to different types of locations, but the online piece, for example, may be just for those sites that are trying to stand up operations, but not yet able to have a scheduling option, and we're helping them fill that gap. We don't want to disturb existing scheduling systems that, say, large hospitals already have in place. They are welcome to use our platform, but if they determine that their system is operational and charging full steam ahead, then we don't want to disturb that at the same time.
Okay, just to follow up, Commissioner Lambrew, with what you're saying, as it is rolling out to the 60 to 69 group, do you want people to only in that age bracket to be registering and people in the subsequent age categories to hold off on registering until it opens up to their age range?
Yes, short answer is yes. We do ask people to really prioritize, because as a reminder, while we are proud that we have gotten, as Governor Mills mentioned, over 60% of our 70-plus-year-olds in Maine vaccinated, there's still many of them out there who have not yet gotten vaccinated. We're doing this overlapping category so we can begin in areas where we're doing pretty well with a 70-plus group, but there's other parts of the state and other people who are hard to reach that we still need to get to. So we do ask people to try to follow this month-by-month schedule as Governor Mills laid out. It's more predictable now. At least people know, and it may not be the ideal answer, but at least we have some degree of planning that can go into this. So we do ask people who are not yet age eligible to hold off on trying to get those appointments.
Great, thank you.
Thanks, Amy. Let me turn it over to Mary Kate at WMTW next.
Hi, good afternoon, and thank you, Dr. Shah, Governor Mills, and Commissioner Lambrew. If I may just ask, this decision you're saying was data-driven, but did you also look at how this worked perhaps in other states who did take into account pre-existing conditions, and did that factor at all into the decision of how you've seen things play out in other states?
Governor, please.
The answer is yes, we did take that into account. And predominantly, the major thing that differentiates Maine from a lot of other states is our age, frankly, being the grayest state in the country. And I think Dr. Shah has explained a lot of the other issues that we have been dealing with, and the logistical difficulties of going by category, by what your job is, et cetera. And actually, Connecticut is doing something similar to what we're doing. I believe they're dropping down to 55 maybe next week, in addition to some other categories that they've selected. But again, we're a rural and very dispersed state and a very graying state, an older state. So those are our priorities right now.
Now, Mary Kate, in my research on this issue and my evaluation of it, I spoke with counterparts of mine, health directors in other states, as well as friends of mine who are practitioners in a number of other states. And I heard two themes throughout from this operational perspective. One was a recurring challenge, three themes. One is a recurring challenge of verification. How does anyone on the vaccination side know whether the person they are vaccinating or registering indeed has the condition that they have, or indeed is a frontline worker in the category? The second were questions of severity. Is it all or is it some? Is it all folks with diabetes or only those with uncontrolled diabetes? That was a difficult question. But you know, Mary Kate, the thing that compelled me of everything I heard were concerns that many of whom I spoke with, including clinicians here in Maine, expressed around envy or stigma or skepticism that they were seeing emerge in the line itself. People who are waiting in line at a large center, looking around saying, that person doesn't look 70, or why is that person here? They don't look sick. And I heard that from colleagues of mine in a number of other states, people openly calling out and saying, that person doesn't look like they are ready to go right now. How sick are they? What do they have that merits them to be vaccinated today? And that is precisely not the system or the spirit that we want to be communicating right now.
And I will say I heard something similar on a call yesterday with all the governors, and we were joined by the president for a time. And we discussed briefly what criteria we were employing. And I heard several governors indicate they were moving towards an age-based eligibility system rather than try to figure out which underlying medical conditions are at greater risk than others, understanding at the same time that we greatly sympathize with anybody with an underlying health condition whom the news at least has portrayed as being at higher risk. We want everybody to be as safe as possible. And that is one reason why continuing to wear masks in public places, to keeping your distance between yourself and others, will help keep those with other underlying conditions safer as well.
Turn next to Mal Meyer at WGME.
Thank you for taking my question. I understand what you're saying about the correlation between age and severity of disease, but did you consider looking at the data of people's age coupled with their underlying health conditions, and did that impact the data at all?
Sure, Mel. So these are, I won't go into it too much. We're happy to chat, but there are independent and dependent indicators of severity. Many of the data sets show that age is an independent indicator. So even if you control for some of the other underlying conditions, age still tells you more about whether someone will suffer or even die from COVID than even their other health conditions. Now, certainly there may be gradations there. As Governor Mills mentioned, there may be groups that hear this news and say, this isn't what I was hoping. But as an approach for the entire population, age alone remains a strong indicator of whether someone will die or suffer serious consequences as a result of having COVID.
Clearly,
add though that, I'm sorry, go ahead, Governor.
clearly there's overlap. There are many people 60 years of age and older who have underlying conditions, a great number of people in Maine. And so they will benefit from this approach as well.
And I was just going to add that we have from the start said that within a category of eligibility, a provider site can prioritize those who are more at risk. So within the 60 plus, age group, a provider that knows that it has a lot of oncology patients or people who may need organ transplants can work to vaccinate those age eligible individuals on a priority basis. They also can, going to this issue of equity, work to vaccinate those people who may have low income or transportation challenges or otherwise struggle to get a vaccine. So nothing about this age categorization changes our focus on within those categories, targeting those people most at risk medically or socioeconomically, or for some other barrier that might prevent them from getting a vaccine.
And then my second question is, and this was discussed a little bit yesterday, but there are still 5 counties that still have under 50% of people 70 and older getting their first dose. So will you be directing healthcare providers to prioritize those people when signing up for appointments, especially when people 60 and older can start signing up?
I don't think we're not going to direct healthcare providers to take county of residence into account. I think what we're going to do, what I think is a even more effective strategy, is to work with providers to make sure they are equipped with the vaccine that they need to have, whether by standing up drive-through clinics, as the governor mentioned, supporting consortia of healthcare providers who are coming together to do 1,000 shots a week, particularly in counties and areas of need like Washington County, Aroostook County, Somerset, Franklin, and Oxford counties, as well as then making sure they've got what they need to be out there vaccinating their own patients.
Maybe I can clarify my question. My focus is not on the counties that they come from. Rather, once people 60 and older are able to start signing up, will healthcare providers be directed to prioritize people who are 70 and older who are more at risk of severe cases of COVID?
Healthcare providers are free to make those decisions within the scope of their practice. But in general, what we're focused on is eligibility. Within that, if a healthcare provider decides to set aside a couple of hours where they're going to focus on those 80 and over, for example, or 70 and over, that is an option that they have available to do. Let me turn it over to Jessica Piper next.
Thank you, Dr. Shah. I wanted to ask about how any of this changes how the state is thinking about some of the physical distancing restrictions, both for individuals, who might still be required to quarantine when they come back from another state after being vaccinated, as well as is the state considering anything like, increasing capacity limits once people over 50 are all vaccinated, for example.
Yeah, let me answer if I may briefly, Jessica. Thank you for the question. These are things we talk about just about every day. And we're looking at all those issues regarding not so much the distancing and the masking, because those are going to still be in place, I think, for a while, because we have to protect those who have not been vaccinated, who may be still very vulnerable to the disease. We don't want anybody to get sick. We don't want anybody to be hospitalized or even die from COVID-19, anybody. But the travel restrictions, the indoor capacity limits, the outdoor capacity limits, all those things are constantly in play here. As we look at increased vaccination rates and case numbers, hospitalization numbers, all those things are in play. There's a balancing that goes on there. And yes, we'll continue to look at those issues, the capacity limits, whether it's about churches or theaters or sports arenas, casinos, all the above, and other protocols. But for now, we're certainly keeping the protocols and the guidelines in place. For instance, for restaurants, for hotels and lodging, for other venues, public-facing venues, retail, etc. For now, they remain in place.
And for individuals who are vaccinated, is there a possibility that they'd be able to skip out of like the quarantine requirements soon for coming in out of state? Or
people from other states, you mean? We're looking at that, and we're looking every day at the vaccination rates of other states as well, because obviously that's a factor here as well. We continue to look at that.
All right, thanks.
Thanks, Jessica. Let me turn it over to Morgan at WABI next.
Hello, everyone. Thank you for taking my questions today. So for those who are 60 to 64 who may not have been expecting this announcement, can you kind of talk about what they should be thinking about this week?
Well, one thing is, I guess, 65 and over, there's a higher percentage of people 65 and over who are eligible for Medicare or receiving Medicare benefits. 60 to 65, not so much. So they need to have their insurance card, be prepared to help the provider, the vaccinator, validate their insurance coverage, or if they don't have insurance coverage, the vaccination clinic will be submitting the bill to the federal government, presumably, that kind of thing. But in terms of being prepared, it's the same as people 70 and above, I guess. What would you say, Dr. Shah, Commissioner Lambrew?
Want them to think about is what they're going to do 2 weeks after their second dose, and how that means they can start getting back to the normalcy that so many folks have been craving. The other thing that I would tell them to do more tactically, or ask them to do, sorry, is just investigate what the best vaccination option is for them. There are different ways to do so. The Maine DHHS, the governor's COVID-19 vaccine page, has a list of numerous places in Maine, everywhere from commercial retail pharmacies to large-scale vaccination clinics that are offering vaccine. It's got information on how to sign up for them, and there are more sites coming online. So check early, check often.
My next question is about the drive-through sites. Is there any information you can give us right now about potential sites that you're looking at, the type of places you're looking at, and who may be operating these sites?
Morgan, we're still very much in the planning phases. Step one is awaiting whether the FDA will issue an emergency use authorization, which opens up that modality of vaccination for us. That's really the top thing. We'll see where the US FDA and the US government go, but based on that, that's where our planning will go. We're very much in the planning phases.
Okay, thank you.
We are, however, hoping to do at least two things. The first is work with local providers, folks who know where the right places to set up shop are. The second is continue our focus on areas of need. So we're purposely thinking about places in Maine where, as the commissioner noted earlier, and as one of the other questioners did, we want to get folks in older age categories up to speed and up to being vaccinated. So we're trying to cast a net in that fashion. Let me turn to Patty White for the final question of the afternoon.
Thanks very much. You addressed this a little bit in the question about what other states are doing, but I just want to make sure I understand correctly. So the age-based approach will help us move through this rollout more quickly. Is it because it's just more straightforward than determining high-risk medical conditions, or are there other reasons why this will be faster?
Well, I think any of us can answer that perhaps, but yes, the answer is yes. It will be easier to verify eligibility by age. But it's not just ease. It is the risk factor that's most important here. The fact that we can vaccinate the highest number of people in the quickest way, quickest fashion, that's huge. This is a race, again, between vaccination and the emerging of the variants. We want to win that race. And this is one way we do that and save the most lives in the meantime.
Thank you. And are there any circumstances where there would be exceptions? I'm thinking about, we were contacted by a parent who has a high-risk child who, it's unclear when the child will get vaccinated. Will there be any exceptions to this age-based rollout for people in that kind of circumstance?
Jeanne and Nirav can answer this better than I can, but I don't think the vaccines have been tested on children, or they haven't validated any of the current vaccines' effectiveness on children yet. So the question is a little premature, but go ahead, please.
Look, I was just going to add, it's heartbreaking to talk to some of these parents and hear about their challenges trying to keep their children safe, themselves safe. Again, the governor mentioned younger people with serious health conditions. We know that there's many people out there for whom, if there were an ability to do a one-by-one determination across the state of Maine for who's at greatest risk, that might produce a different answer than what we have to do as a state is create a policy. The policy is based on groups of individuals, not individuals. And when you look at that set of people, again, as a group, as Dr. Shah outlined, the evidence does strongly suggest that the grouping that matters the most is age. So we have to do an approach that is population-based, group-based for the state of Maine. We don't have the ability or the capacity to go one by one to do eligibility determinations. And I think, Governor Mills articulated this well. I mean, these are hard decisions, but we went with the science, and that's why we took these groups and made them eligible first.
Patty, I would only add on top of what Commissioner Lambrew noted, even though I used a metaphor earlier of a doctor assessing the risk of a particular patient with COVID and whether that patient would die or have severe consequences, and age as a exquisite predictor of that metaphor does glide over the fact that although the intention is to think of everyone in Maine as the patient, we are doing something slightly different. We are charged with public health decisions, not so much individual patient decisions. And as Commissioner Lambrew noted, on an individual level, we recognize that this approach may leave some people hoping for more, but at a population level, keeping in mind our goal of reducing the number of Maine people who are dying from COVID, this is the strategy that will get us there most quickly, and we think most equitably.
Thank you.
Thank you very much, Patty. Governor, I'll turn things back over to you.
Well, thanks. Perhaps in a bit of follow-up to the last question. When that child goes to the doctor, or when that individual under the age of 50 or under the age of 60 with serious health conditions goes to the hospital, goes to the clinic, presents to the ER or even the ICU, we want to make sure that services are available for everybody, that we preserve our basic healthcare infrastructure at all costs. We've been pretty fortunate, I think, because of good planning here in Maine, that our healthcare infrastructure has not crumbled and fallen to the ground as it has in some other states. So we want to preserve, first and foremost, that healthcare infrastructure. And in addition, obviously, do the greatest amount of good for the greatest number of people in the shortest amount of time. It is a race against time. We've stood up, I think, about more than 120 vaccination sites now, with all the Walgreens, all the Walmarts, the large hospital systems, and thank you to Northern Light and Maine Health and all the other systems. And people are getting vaccinated by the thousands now. And we're so grateful for the help of all those partners. It disturbs me greatly too to hear about younger individuals and children with various disabilities and problems in their lives, and children who want to get back into the school, into the classroom. At the same time, I was fortunate enough to visit a healthcare clinic, a mass vaccination clinic in Bangor a couple of weeks ago, along with Dr. Shah. And I do expect and want to visit the one in Scarborough as soon as possible as well. And when I was there, I got the advantage of seeing and talking from a distance, talking with people in their 70s and 80s who had just gotten their second vaccination, and the smile on their faces. I wish I could have taken pictures. I just wish I could have taken a picture and shown it to you today and put it up on the wall, because these are people that I met who had not been out of their homes in 10 or 11 months, who have not held a grandchild, held their hand or hugged them, kissed them on the cheek, had not been with loved ones as they were sick in nursing homes and long-term care facilities, unable to be with them. And now the burden is lifting off them one by one, hundreds at a time, thousands at a time now. And that is a joy to see. And that's what we want to accomplish all across the state of Maine, every segment of the population. We're not talking about who's essential or who's not essential, because everybody in Maine is an essential person. Whatever your work, whatever your circumstance, wherever you live, you are essential to us. And we are going to make sure that you get vaccinated as soon as possible, everybody in the state, and hopefully fully reopen our economy, fully benefit the hospitality industry and all those who work in it and benefit from that economy as soon as possible. So in the meantime, to all the people of Maine, thank you for your patience, your fortitude, your perseverance. We're going to fight this together. We're going to get through this together. Please stay safe.